Hello, and welcome to Nature Connects, TNC in Massachusetts webinar series that connects you with scientists, experts, influencers, and our partners from the Northeast and around the world. Thanks for joining us today. I'm your host, Allison Bowden, Director of Science and Strategy for TNC in Massachusetts. Today, we're excited to be joined by Dr. Kari Nadeau of Harvard School of Public Health to discuss the impacts of climate change on people's health. Before we dive into today's program, I'd like to share a little about our distinguished guest. Kari Nadeau is the John Rock Professor of Climate and Population Studies and Chair of the Department of Environmental Health at Harvard T.H. Chan School of Public Health. She's a physician, scientist, board certified in allergy, asthma, and immunology with over 30 years of experience. She's a practicing allergist and also a member of the National Academy of Medicine. Her laboratory focuses mainly on basic science, mechanistic research on immune tolerance, and environmental exposures to air pollution and water pollution by studying immune cells and their function. She has successfully worked with global leaders, World Health Organization, the UN, the National Institutes of Health, Food and Drug Administration, Environmental Protection Agency, and policymakers to apply scientific evidence toward making sustained impacts in human and planetary health. As you think of questions for Kari, please enter them in the Q&A box at the bottom of your screen. Thanks so much for joining us today, Kari. I'll pass it on to you to get started.
Thank you. It's a pleasure to be here, and I'm so glad to work with the Nature Conservancy. You're doing such amazing things in Massachusetts and beyond. So it's a pleasure and honor to be here, and I'm excited to give my talk, and most importantly, welcome questions from the audience and welcome questions from you, Allison, at the remainder of the time after my talk is over. So I'll share my slides, and I hope everyone can see these. Does that look good? Okay.
Looks good.
Thank you. So I'm going to focus on solutions today. We know a lot about how climate affects health. I'll go through that a little bit, but most importantly and reassuredly, I want to make sure that you know that we're focusing on solutions now to be able to think about how to improve the planet and how to improve our health on the planet as humans. And with that in mind, it's important to note that we learn a lot about CO2 and carbon dioxide in the atmosphere and how that traps infrared and warms our planet. As you can see here on this graphic, the warming of the atmosphere has really been started and catalyzed, unfortunately, by the industrial era. So a lot of the carbon dioxide, as well as other greenhouse gases, are being, unfortunately, emitted through man-made causes. And it's not just about carbon dioxide, it's also methane, nitrous oxide, and we're learning about other gases as well that have long half-lives that can exist in our atmosphere and cause warming of the planet. Now, why do we care about warming of the planet? Well, unfortunately, with the fact that the warming of the planet leads to melting of glaciers and unfortunate extreme weather conditions, we're seeing sea level rise go very fast, and it's gone faster than anything in the last 3,000 years. Global temperatures have increased faster in the past 50 years than any other time in the last 2,000 years. And the current drought, for example, in the Western US is now the most severe drought in at least 1,200 years, and it's persisted for decades. And so these are all important matters to really compel us to think about how we can solve the issues that pertain to climate and planetary health. And our health as humans is inextricably linked to the health of the planet. And when we think about all the different exposures that we have as humans on our own health, with air pollution, dust storms, worsening wildfires, overflooding, temperature increases, and infectious disease, these are all leading to changes in our individual and public health and degrading a lot of the environment around us. I want to first start with air pollution. So air pollution is the silent killer. It is associated with 7 million deaths around the world. This is a nice graphic from the World Health Organization. And you can see on this map that many of the deaths are unfortunately in areas around the world where people don't have the optimal access to healthcare, for example. And because of that, air pollution is not safe no matter where you are on the planet. But when it's very severe and when it's in a place where there's not a lot of health access, it can lead to deaths. And unfortunately, now there are areas in our country where we've had air pollution regulations thanks to the Clean Air Act and other regulations in the US. But unfortunately, because there's been so much wildfire smoke, it's unraveling decades of air quality gains that we've had in the US. So this is a real problem and is something to watch out for, not just in our own country. A lot of you who are from Massachusetts, for example, you'll remember some of those orange days last year in the summertime from the wildfire smoke that was coming to our skies from Canada. So even when you're 200, 300 miles away from a given site where the wildfire is, we're still going to have, unfortunately, the air pollution from that wildfire. There's no boundaries to wildfires, and wildfire smoke can circumnavigate the world. So unfortunately, 80% of the world's population now lives in areas where it is above the WHO standard because of both air pollution from diesel exhaust, but also air pollution from wildfire smoke. Why do we care about air pollution so much, and how do we measure it? Because it's very important as we think about solutions that we know how to monitor. And monitoring air quality and monitoring air pollutants, luckily we have the US EPA, in which when the Clean Air Act was put into place, the EPA measures these pollutants that you're seeing there on the slide. There's at least 188 air pollutants that are hazardous, though, and there's a lot of other substances in our water supply as well as in air pollution that's also toxic. They're not measured as much, however, and so it's important to know that when we measure those 6 air pollutants, a lot of these other pollutants are also coming along for the ride, unfortunately, when we think about the pollution in the air. So that is air pollution, but let's talk about dust storms and how they matter when it comes to climate change. I talked about the warming of the planet. I talked about the fact that there's a lot of drought, and because of that, there's increased dust storms. And not only are there dust storms in the Saudi Arabian Peninsula or the African Peninsula or continent, but unfortunately, those dust storms that you're seeing there in a picture, they also circumnavigate the world. For example, you can see this dust storm picture back about 2 years ago that actually went across the Atlantic. And unfortunately, Florida, parts of Georgia felt that dust, and a lot of people's asthma were worsened. Even within 2 to 3 days of a dust storm, although you might not feel it in your lungs, it's actually affecting your lungs. And that's here where you can see with what we call a meta-analysis. So I've given you specific examples of how dangerous dust is to the lungs, but this was actually what we call a meta-analysis. And this was published last year to show the weight of evidence. You can see the number of countries that were represented in this data set. It's a large data set, and we like to do meta-analysis because it shows that even within 1 day of a dust storm, and that's what lag 0 means, within 1 day of a dust storm, you're seeing an increase by up to 9-fold on average of respiratory diseases in dust storms. And what makes me worried is it's not just about lung, it's also about stroke and other features. This is a slide that shows you about wildfire smoke. And a lot of people ask me, well, how do you know that wildfire smoke is associated with climate change? Well, unfortunately, about 50% of our wildfires now on this planet can be attributed directly to climate change effects because temperatures rising, snow melts sooner, our forests are drier and longer, and so they're acting as fuel sources for any type of ignition that before might have actually been quenched by rain or by other soft and cold and wet dirt. But now, because everything's drier, the fires are more likely to ignite and go severely. Unfortunately, they traverse the land at about 1 football field a second. That is fast. They have their own weather patterns now. And so wildfires are getting more severe, they're getting more prevalent, and they're especially occurring on what we call the WUI, which is the wildland urban interface, for a lot of people that live in these areas. So wildfires really aren't wild anymore. 50% of wildfires cover commercial and residential areas. And this is where we really need to think about how to help people's health and help people and the planet. The worrisome thing to me about wildfires is that they are about 10 times as toxic as diesel exhaust pollution. All air pollution is toxic, but the smoke from wildfires is actually more toxic because, as you can imagine, it contains pieces of fabric from your couch, or it has the paint thinners in your garage, or it has the detergents and shampoos that just got incinerated that were in your shower. And it's important to know that those chemicals are oftentimes more dangerous than just average air pollution because they contain particles that can induce cancer, for example, or immune problems. And they also contain plastics. So we think about all of this as it pertains to wildfires. There's a lot of good research now that's being done that acutely and chronically wildfire smoke can affect people's health. And it increases asthma, chronic lung disease, cancer, stroke, heart attack, skin diseases, and eye diseases as well. So that's now shown in many scientific literature pieces. What about flooding? Well, we need to worry about flooding. We're in areas of Massachusetts where we have wonderful water supplies and lakes, as well as we're near an ocean. So this is something that we need to keep in mind as sea levels rise. And we know that last year, even in places in Vermont, there was so much water within a given period of time that they were worried about a dam being broken. So these are the types of things that we need to look at in terms of flood risk areas and how to maintain our waterways better. Many of you have already learned that 3 islands are disappearing because of the sea level rise. And so we need to think about Indigenous peoples and how to help people that are underserved and that are losing their land, their culture, and their homes because of sea level rise. Flooding is not only problematic for those reasons that I just gave, but also because when you have flooding, oftentimes that water then becomes stagnant, and that leads to toxins in the water, fungal overgrowth, bacterial overgrowth, vector replication, i.e., tick-borne diseases. Mosquitoes like to grow in stagnant water. There's increasing health issues, evacuations need to happen, and a lot of mental health stress occurs because of that. There's food insecurity because of flooding, and a lot of stress, as I mentioned. With increasing heat, there's also problems with that alone on our health. And we are facing, unfortunately, some of the hottest areas in the country that have the hottest places on Earth. And even in areas like the Arctic, we're seeing incredible melting and heat that is rising in places that otherwise would have been much colder. And this is, again, another meta-analysis to show you one specific example of a health outcome due to heat alone. This is not due to air pollution, this is not due to wildfire smoke, but just having a heat wave can actually increase your chances of asthma. And this is a meta-analysis showing you that there's around a 2-fold risk. You're 2-fold more likely to have an asthma exacerbation when there's a heat wave. And what about mental stress and mental health? This is, I think, a very important item to speak about as we think about climate change. All of the climate change events and severe weather conditions, they take a toll on us, both acutely as well as chronically, and they take a toll on everyone. UNICEF has reported that for every child born on this planet today, they will suffer through at least one climate change severe event. And that will affect their health. It will also affect their mental health. And so you can see here that there's issues around post-traumatic stress disorder, depression, domestic abuse, and importantly, unfortunately, when our planet gets hotter, when areas of the world get hotter, that also increases suicide rates and increases domestic violence. So these have indirect effects of other people's health as well. What about pollen production? For those of you who have allergies, 1 out of 3 people on our planet has allergies. A lot of people in Massachusetts also have allergies. We have beautiful green spring, but that also comes with it a lot of pollen. So CO2, you'll remember from your high school science courses that CO2 actually increases the growth of plants because plants like CO2 and that allows us to breathe better. And that's a good thing. However, CO2 also causes certain plants, especially ragweed and grasses, to grow faster. And with the onslaught of increased CO2, with parts per million increasing above 400 now, as well as the fact that we're warming the planet and there are places on Earth that otherwise never saw ragweed, but now they do, like places in Denmark, as well as the fact that now our seasons are getting protracted because we have a warmer planet, and especially in Massachusetts, for example, our pollen seasons are getting longer. We need to think about pollen production, asthma, exacerbations, and allergic rhinitis and other allergic diseases. So this is something that is also attributed to climate change and it affects our health. The last thing I wanted to talk about is infectious diseases. We have the understanding now, thanks to a lot of infectious diseases occurring throughout the world, unfortunately with COVID and others, we understand the transmission dynamics of a lot of different diseases and vectors like mosquitoes and ticks. But with that, what we call pathogen emergence, as we have a warming climate, we also have vectors that are basically transgressing boundaries that they wouldn't have otherwise went across before. And so because lands are getting warmer, for example, we're seeing diseases that otherwise only were seen in South America now occur in Texas, for example. In Massachusetts alone, for example, we've seen a spread of Lyme disease, and you can see across 1996 to 2018 that as the globe got warmer, as the US got warmer, the tick species went further west. And so we're seeing a lot of Lyme disease now in areas of the country that otherwise didn't have it. Now our ticks, for example, in the Northeast are not only carrying Lyme disease, but they're also carrying other diseases. So please be careful if you get bitten by a tick, be very careful and go to the doctor right away because these ticks are now stronger and they're more frequent and they also have, unfortunately, more diseases that they carry. So I've talked a lot about the problems about climate change and the effects on health, both directly and indirectly. But I want to make sure that everyone knows that we have room to be hopeful, and that's important. But in that room to be hopeful, we also need to have a mindset of balance. And in that mindset of balance, I wanted to talk about both the positives and the negatives. And the negatives are something that I'd like you to take home with today to really catalyze you to be citizens of the world and to really think about how we can act and how we can do better in terms of policies to help change this graph. You're seeing this graph now where our current policies, thankfully, based on policies in Europe, based on policies like the Inflation Reduction Act here in the United States, based on the Clean Air Act, we are now seeing reductions to some extent of greenhouse gases, but not enough. We need to get to net zero by 2050. And there's a lot of movements going on now. We have the youth movement, which is great, but we need to join it as adults. We need to be part of the solutions. Something called Conference of the Parties, or COP28, which is the UN's meeting where we discuss climate change for the first time this year, discussed health and focused on health. 143 nations signed a declaration to health and climate and doing better. We've done a lot of work in terms of reducing the cost of clean energy. Sales of electronic vehicles are increasing, which is fantastic. And importantly, we need to do better. There are 20 nations still responsible for 76% of the greenhouse gases on this planet. 6 major countries contribute the most. The people, unfortunately, that contribute the least are suffering the most from global warming. We need a blended financial model to make sure we can help those low to middle income countries as they're suffering, think about solutions for climate change. And a lot of them are coming up with their own solutions and building resilience and capacity building. And that's fantastic. And we can learn a lot from them as well as from indigenous peoples and traditional ecology. We're heading towards a 2.8 degrees centigrade if we stay in the current policies, as you see from this graph, but we need to do better, get down to net zero by 2050 and at least stay within a 1.5 degrees centigrade increase. By 2050, we're supposed to be there, but we're only 1/3 of the way there. We need to work on the health inequities and climate change. And we also need to make sure our infrastructure can withstand the demand of the electric system. And I think a lot of new policies are being provided for that very item. So facing forward on solutions, we are really focused as academics, as nonprofit organizations on education, on research and action. And all of the solutions that we're talking about today are science-based. They have good evidence behind them so that we can test them and make sure they're working for everyone. And if they're not, why not? And how can we do better? And most importantly, have these science-based solutions be policy oriented so that they can help policymakers make decisions and make decisions wisely with information. And a lot of measures to reduce climate impact on health are located here on this slide. We need collaborative work, we need multidisciplinary work, we need more research. The Nature Conservancy is really catalyzing a lot of multidisciplinary work with communities, which is fantastic. And with that, I want to talk about two major areas of solutions. One is adaptation, and the other is mitigation. First, adaptation, in which we're building defenses and preparing for the consequences of climate change. And then I'll talk about mitigation, which we go upstream and try to stop the warming of the atmosphere via reducing greenhouse gases. So let's talk about adaptation. A lot of you see this orange sky. You might have seen it here in Boston or in parts of Massachusetts or New England. But this was worrisome. And again, this is hundreds of miles away from the wildfire smoke in Canada. And when people had that smoke and were breathing it, a lot of people were coming to my clinic and saying, what do I do? Well, there's some evidence to say that you absolutely need to stay indoors as long as indoors has a good air filter. You should wear an N95 mask. This mask that this child is wearing is during a wildfire in California, and that's doing nothing to help her reduce the possibilities of taking in air pollution from the wildfire smoke. So personal masks that are cloth masks or surgical masks don't do it. N95s do. Don't exercise during wildfire smoke. Air quality index of about 100. You should not be outside exercising because your lungs can take in that air pollution toxin even more. Definitely stay indoors if you can and avoid polluted environments. So the data behind what I just said is located here on this slide. The air filters to best use are called MERV 13. So if this is helpful to all of you, I hope it is. You can tell your families about it too. But there are a lot of filters out there that you could possibly buy on the internet or buy at a store. But you've got to look at the grade because the grade matters. And when you do put an air filter in your home, you need to change it out every 6 months or so because it will get clogged with dirt and air pollution, and especially during wildfires. So MERV 13s are the best. You can even go higher than that, but then you need to replace it even more. N95 masks are the best masks to wear during any air pollution as well as wildfire smoke. So you see this pink line here. N95s are the best to be able to decrease the likelihood of having to breathe in bad particles, but they're not perfect. You can still smell gases from the N95. So the best place to be is away from the wildfire smoke. But unfortunately, a lot of people can't evacuate. Then, because of all this, we again need to think about those families, those children, those places on the planet that don't have the reserves or the ability or the resources to get filters or to get masks. So what we started in California, for example, what I hope starts in Massachusetts is we got free air filters through a program for physicians to write prescriptions for families that are lower income. And now we can provide those air filters to families in California. And we're hoping that we can do the same in Massachusetts and other states because it really does help their health. And when you think about air filters, and again, is to all help you, think about the fact that one air filter might not do the trick. You really need to think about what type of air filters and how many you need to help filter an entire household. Now, some air filters are not very expensive, but you need to know how many to use in a given house to be able to reduce air pollution. And why is that important? Well, it's important because people have studied, and again, this is another what we call meta-analysis. This is a large network of data where people have independently shown evidence to be able to prove that by using an air filter, you can actually improve asthma. And that's seen here by this curve where you're seeing to the left of the line, many people going to the negative values on this x-axis, because that shows you that their asthma is improving, and that's great. So when we showed this to the governor's office in California, they were able to use this data as well as many other pieces of data to actually set up clean air rooms. And this might not be for everyone, but for people that work outside, for example, and can't evacuate a wildfire or air pollution, it's important to put clean air rooms around so that at least people can spend a number of hours in the clean air. Now, I want to get upstream to adaptation. We talked about wildfires, and one thing I hope that all of you will learn after this talk is that we can take care of our planet better. And I love the fact that Nature Conservancy is really involved in this. So you can see in this drone picture the no treatment area of a wildfire. Unfortunately, this is in Oregon. With no treatment, that wildfire was again going across that land by about a football field a second. And you can see there's just scathing reduction and damage to the land. In the middle panel there, you can see that that was part of the Native American land. So traditional ecology was being practiced where they were already taking up pieces of the fuel sources in the bottom ground floor and having small fires to reduce that fuel. And they were also thinning the forest, every other tree was cut down, compared to the last panel, the lower panel, where every other tree was cut down, but there was no regular prescribed burn being used to help treat the fuel on the forest floor. And so because of that, you can see to the extent that there was resiliency and that swath of land that was in the Native American reservation was protected against the wildfire. So things like this are important to know and to see, but unfortunately, there are a lot of policymakers that were afraid to actively promote prescribed burns or beneficial fire, we call it, because of the risk that people in the community were worried about that the smoke from the prescribed burn could also affect their asthma. So what we did was, thankfully, to the Nature Conservancy and funding, we were able to show and compare people that were in the same community that were exposed to a prescribed burn smoke compared to wildfire smoke. And this is, again, a small study, but importantly, it's one of the first of its kind to show that because we were looking at air pollutant monitoring, thanks to the US EPA and criteria pollutants, we were able to show that based on the data that we had across the Central Valley in California, you can see here on the x-axis, the prescribed burn time point versus the wildfire smoke exposure time point in the same population. And on the y-axis, you're seeing the symbols of parts per billion or nanograms per meters cubed. And that can help you know that there was actually a reduction in some of these pollutants when there was a prescribed burn. In addition, we also did immune function studies of the people's blood at the same time. And on the y-axis, you can see the Th1 cells, which are important cells to be able to have a good immune response to things like COVID or to things that could be infections or to vaccines. And what's interesting here is that you can see during the wildfire, those cells were much lower than in a prescribed burn or in a control group. So it's important to also think not just about adaptation, but also about mitigation. And these two solutions are not mutually exclusive. They can occur at the same time. And mitigation options are many. As I spoke before, we want to get up to only 1.5 degrees centigrade. And to do that, we need to be able to go net zero by 2050. And to get to net zero, that means we have to reduce emissions and increase carbon uptake. And so you can see there are a number of mitigation solutions that are in the bullet points. And so what are we doing about that? Well, I think across the state and across the world, going, for example, to electronic vehicles is important. Buses, transportation contribute to a lot of greenhouse gases as well as large vehicles. And so I think there's a big movement to be able to electrify vehicles, as well as we need to help the infrastructure with electricity and use renewable energy for that electricity. But I wanted to also show you some more recent data, because when we talk to policymakers, it's important to frame a given outcome in terms of what they're really worried about. And a lot of policymakers and decision makers are worried about the costs and the economics. And so we recently published this paper in a journal called PNAS, in which we actually looked at, thanks to wonderful researchers at the Harvard School of Public Health, my colleagues Ernani Choma and Lisa Robinson, we looked at the health benefits alone and climate benefits of switching out a diesel bus to an electric bus, just one. And one saves us around $270,000 per bus. And that even can go higher, and it's in a city. And so I think it's important for us to know that as we think about how to calculate the benefits and the costs, it's important to know that for every dollar put into renewable energy, for example, you get at least $6 out in terms of health benefits and benefits to the planet. And this is another example of a great solution and a mitigation where if you can increase tree cover in a city by at least 30%, you can reduce temperatures by 1.3 degrees. And that's important for cities, especially because there's heat islands in cities. And that can reduce premature deaths due to heat waves by 30%. So these are all, I hope, things that you'll take home and teach other people, because enhancing tree cover is important, not just for carbon sequestration, but also for cooling. And a lot of people ask me as an allergist, well, if we plant trees, does that mean we're going to have more allergies? And that's actually not the case. As long as you have appropriate trees, again, native trees that are native to that area, that are matched for sexes, and that aren't just one sex of any given tree, that you actually have lower amounts of pollens that are emitted into the air. And that's really important too. And again, I want to leave you with some hope and promise that by changing this, for example, Los Angeles, when they put regulations together for air pollution, that actually improved outcomes in terms of lung development in their children, that their children's lungs literally were able to expand and grow better because they reduced pollution in areas around Los Angeles. So these are all things to be happy about. With biodiversification, we've also seen an improvement in mental health. This is a case in Australia where they have greenery around their primary schools and compared it to places where there was no green in their primary schools. And even those schools, everything else being controlled for, had an improvement in punctuation scores, grammar scores, reading, and cognition overall. So I want to leave you with those solutions and with some of the great outcomes that have happened. We need to study this more, do more research, find out it through an iterative process how well these solutions are working. And these recommendations for change, I know a lot of you know, but I think they can never be overstated. It's important to transition to healthy and sustainable practices. Let our own individual practices be good role models for others. Remove fossil fuel subsidies and invest in renewable energy. Talk to the community, find out their needs, increase access to healthy transport options, for example, strengthen our public health system. We can all talk to policymakers as citizens of the US, invest in healthy recovery and prevention, and green more areas, and that can lead to carbon sequestration and better health for our planet and health for ourselves. So I'll stop there, and I want to thank you all for your attention, and I'll take questions. Thanks.
Thank you so much, Kari. Your commitment to this work is really inspiring and will certainly continue to motivate us here at the Nature Conservancy to work toward a better future for everyone. So we'll move to audience questions. Just as a reminder, as you think of questions for Kari, please put them in the Q&A box at the bottom of the screen. And I will jump in with one. So you talked a little bit about the cost benefit of health and climate change solutions with the bus example. Can you say a little bit more, maybe broadly, about the cost benefit of health outcomes relative to the cost of climate change solutions?
Yeah, thank you. The benefits are huge, and what we typically do when we study benefits, we just look at mortality risk alone, i.e. the risk of dying. But now people are looking at, okay, well, what are the benefits if you can decrease the likelihood of someone going to the emergency room due to an asthma effect or due to stroke or decreasing their medication use? And so the economics could be way more than just those that I'm going to tell you about right now, because we've been very conservative in our estimates. But they could actually be way north of that, because now the economicists are looking at these other benefits that up to now haven't been looked at. They've only been looking at deaths. So with deaths that can be reduced by these types of measures. So importantly, for example, like I said, for every dollar that you put into renewable energy, just for children's health benefits alone, you get about $6 out for improving asthma care, for reducing the chances of going to the emergency room, for reducing the chances that that parent has to take off from work. So that's a $6 profit from a $1 input on renewable energy. And that was done in New England. So that study, though, is very generalizable across the US. There's another study that showed, for example, in FEMA, for every dollar that they put into emergency preparedness, and this is a lot of adaptation. So if you put in every dollar in FEMA for emergency preparedness when it comes to being ready for a flood, being ready for a heat wave, that actually turned out to have $13 in terms of benefits to be able to reduce the cost of loss and damage due to an extreme weather condition associated with climate change. So that's like $13 for every dollar you put in. So there's a lot of good economics frameworks to put around the benefits of dealing with these solutions and working on them together to be able to see the benefits, not just to our own health, to the planet's health, but also to economic health. And there's a lot of jobs now being created thanks to renewable energy. And I'm excited that that will hopefully trail up.
That's fantastic. It's so important to have those types of information to influence decisions. Can you say a little bit more about bringing science to decision makers to help them protect the environment?
Yeah, I think this is so important that as scientists, we don't want to just keep our science in a fishbowl. It can't just stay in some academic place. We want to make sure that it gets out there, and we want to make sure, just like I showed with these meta-analyses, that other people can test it. But for now, there's so much weight of evidence. We don't need other people to test these things anymore. Now we're at the time point where we can bring it to the policy makers. It's ready, it's done. We now have the means, we have the resources, we have the funding to be able to put these solutions into place. Now we need the political willpower. And that political willpower comes through talking to policymakers and decision makers. And so I'm really grateful. And again, in a good bipartisan relationship, being open-minded, I'm working with the National Academy of Medicine with Bill Frist, who's a senator from Tennessee, as well as a Republican. And so it's really great to see that a number of people are coming together across the aisle because we care about the future. We care about our children, our grandchildren. We want to make sure this place is left in a better state.
Uh-oh. Are you with us, Kari?
Because communities are being affected locally.
Thank you. We lost you for just a second there.
Oh, sorry.
That's okay. We definitely got the answer. I think we maybe have a little instability in the internet. So we have a great question here from Sadie. With the increase in poor air quality days, excessive heat days, and high allergen days over the last 3 years, we don't open our windows nearly as often as we used to. We live in a rental house built in the late 1800s and have been buying air purifiers to help combat allergies, but also because we noticed our house becomes stuffy when closed up. We've suspected that we may be trapping or growing other concerning air quality pollutants in our home, but don't know where to start our investigation. Are there some more common and/or serious potential indoor pollutants we should be keeping in mind when we close up our home during extended poor air quality days?
These are excellent questions. So, we want to be able to help you individually. And so with that, I'm going to give you some information and some suggestions, but these are suggestions. I don't work for these companies. I don't work for these places, but there are remote sensing monitors that you can buy off the internet. There's something called AirThings. We use them in our classroom to teach students how to monitor the air inside their homes. You can also place it outside your home. So it monitors for some key things like pollutants as well as temperature and humidity. And that's helpful. It doesn't measure everything though. We're only as good as our measurement tools. So we need to put some more funds into businesses doing remote sensing. And then there's also another group of places you can buy monitoring from something called Purple Air. So you can get Purple Air monitors and place that inside and outside your home. So I talk about the monitoring first before I talk about how you might filter the air, because you want to be able to monitor whether or not the filter is working. So I would say for your specific question, Sadie, that to buy an air filter would be really great. To be able to, if you have central air, get a MERV 13 filter that you can put into your central air um, conditioner, either for heat or cooling, and that will filter out some of the things that you're noticing when you close the windows and you close the doors, that you're feeling the stuffiness. That'll also get out molds. The ionizers that you buy at other stores, those are not helpful whatsoever. So please make sure that you get MERV 13 or above filters. You can also buy HEPA filters for your home, and you put them in different rooms, and that'll clean out the air. But most importantly is to measure how well that is cleaning, and that comes with the air monitor. Does that help?
That sounded great to me. What a thorough answer. I hope that that is helpful to Sadie and to her family. It's such an important question. There's a question here about anything that Massachusetts is doing particularly well or perhaps badly that would be a priority to change. And did I hear recently that Massachusetts is doing expanding its air monitoring networks?
Yeah, and Allison, feel free to chime in here with your role in the Nature Conservancy in Massachusetts. But if people saw, there was a recent news article in ABC showing how much Massachusetts has been doing for mitigating and adapting to climate change. And if those of you interested, those of you who are residents in Massachusetts, go on the Massachusetts website, because there's a whole climate change action plan that the governor, Governor Healy, has rolled out. And thanks to Melissa Hoffer, who is our climate leader for our state, that there's different action plans for different parts of Massachusetts, because different parts of Massachusetts are being affected by climate change differently. So I'd say Massachusetts is doing a great job. We can always do better. We need to really focus on low to middle income communities. We need to focus on our Native American populations that have really been suffering. And food supplies are becoming scarce for them, for example, because of the reliance upon nature for food. So I don't think, we're there completely in the state of Massachusetts, but I think we are making great strides. And I'm really proud to live in Massachusetts because of that.
We are fortunate to have made so much progress here. You're kind of touching on the importance of an environmental justice perspective. I wonder if you could say a little bit more about the idea of just transition.
Yeah, thank you. So when people hear about environmental justice, they can sort of be confused by that. And so first, when I talk about environmental justice, I like to define it. And when we think about environmental justice, it's really about providing justice and equity to those communities that up to now have been inequitably exposed to environmental toxins. For example, there's this whole concept of red zoning, where there were people of color specifically, that were put in certain areas near toxic waste dumps by real estate agents, and that they had to live near there. So already they're living near a toxic waste dump, and then or a highway. And then on top of that comes in climate change. And so that is like worse upon worse. And so when we think about environmental justice, we like to think about those communities that are already inequitably exposed and most likely under-resourced. And so when we think about transitioning to a cleaner environment and going to net zero, like I spoke about today, we need to make sure that those communities are the ones to track the most. That if what we do to solve climate change does not help those communities, then who are we as a society? So I think in these just transitions, we need to make sure that when we track how well we're doing, we need to make sure that those communities have been helped. And by understanding what they need, we can help them better. So the other part about environmental justice is that in this transition to a cleaner environment and doing it justly, we need to work more with communities, engage the communities, find out what they need, and then move accordingly.
Excellent. Thank you. There's a question here from a guest joining us from San Antonio in Texas called Bill Barker, who says that he's concerned about the impact of increased temperatures. Maybe you could reflect a little bit about when air temperature becomes dangerous, but he asks a follow-up question. about people setting up playgrounds underneath freeway overpasses. Is this a bad idea because of the air pollution? So kind of putting the pieces together of,
Yeah.
Go ahead.
Yeah. Thank you, Bill. These are great questions. So let's unpack them. So the first question is about temperatures. People should know that there have been a lot of studies in medicine on what degree of heat is dangerous. And you can imagine if like 95 degrees Fahrenheit for more than 8 hours is dangerous to a 65-year-old or over. That increases their rate of potential death by about 10% to 16%. So that's serious. And that's why, especially older people, need to be very careful about hydrating, reducing temperatures, because we have a lot of places in the US, especially in San Antonio too, where it's over 95 degrees Fahrenheit. So for people that are under 65 years of age, that is also dangerous. You can still have heat stroke and heat stress if you're out for more than 8 hours, and especially for those that exercise. So for people that are exercising and they're in an area even greater than 85 degrees Fahrenheit, that also can induce heat stress and heat stroke. So these are gradations of temperatures for different ages and for different scenarios. 1, 85 degrees for exercising people. 2, 95 degrees just for a few hours for 65-degree or older. And anyone that's out at 95-degree temperatures for a long period of time could have heat stroke. So I would say between 85 and 95 degrees is where you definitely don't want to be outside for a long time. And that's easier to say than do. So I understand that, and we need to make sure that we have cooling rooms, cooling places, ways to cool the planet so that people can go into the shade, hydrate, and get out of that heat. Because it does lead to a lot of heat-related deaths, as well as premature births and unfortunately, and premature deaths. So the second question you had is whether or not to build a playground underneath a highway. That would be a no. So people have already studied in LA, for example, that if you have a school or a home that's even 100 feet away from a highway, that person has a much higher chance of asthma, up to 30% more. So I would say that if you can talk to your city council about not doing that, that'll help having asthma.
So I mean, that makes perfect sense, and those are great data. If that playground that's under the overpass is the only place that you could get outside, how might you think about that in balance?
Yeah, of course, I'm such a supporter of the outside and being in green spaces and being in the air. But if you need it to, and of course, exercise is important, I would say to please put a cover over that, be in a room like a clean air room that you can filter the air and then still have the playground there, but then have it be immersed in a place where there's filtration and that you can provide clean air to those children. And that's possible. You can put playgrounds in clean air rooms.
Oh, interesting.
Mm-hmm.
There's a question here from George Gaines. Are there studies on prenatal exposure of these environmental hazards? You mentioned premature birth in the
Yeah,
last answer.
absolutely. There's studies, air pollution probably being the most because we've had air pollution, unfortunately, on our planet for a while. So prenatal exposures to air pollution, for example, can induce allergies, asthma, even prenatally, even when the child is born and they're not born to a polluted environment. If the pregnant woman was in a place where there was high amounts of air pollution, then that will increase the likelihood of that child being born with asthma and allergies and other diseases. We can actually mark that in the DNA, and we can actually follow it in the DNA of the child born to the mom. So that's how we know prenatal exposure is there and unfortunately does lead to certain outcomes. Now, not everyone leads to that outcome, but some people do. We're trying to understand those protective features too. Exposure to environmental hazards like arsenic in the water supply or heat can lead to prenatal exposures that can then lead to premature deaths or premature births. So it's yet another big economic burden.
We lost, would you like to say just the last phrase one more time? We
Ah,
lost you again.
I'm sorry.
Another big economic burden. Was there something after that?
Yeah, by reducing greenhouse gases, we can save on the economic burden of premature births and premature death due to
Perfect.
environmental exposures in pregnant moms.
Thank you. Um, Susan Richmond asks, as an early childhood educator, I wonder if you have any suggestions for empowering young children and their families.
Oh, that's a great question. Thank you, Susan. The Aspen Institute now has a great program run by my colleague Lauren Schiffer, who's also here as an associate professor at Harvard. So if you'd like to, you can go online, the Aspen Institute. There you can download a lot of wonderful educational materials for children and climate change. And it also helps us learn as adults and families and moms and dads and caretakers. The EPA also has some great materials that you can have as a teacher. The CDC also has some great materials on their website. And forgive me, Allison, for not knowing what the Nature Conservancy has on their website, but I'm thinking that as we move forward, there's a lot of great educational tools, and we'd love to get feedback as to how well these tools are working. We've been doing a lot of work in the center that I run, the Climate and Health for the Global Environment Center at Harvard, and we're specifically navigating these education materials in different countries and with different languages. So there's a lot of these materials are also translated in different languages too, if that's helpful.
Wonderful. Thank you. And Sadie replied, thank you for your thorough answer from earlier. And she has a follow-up question that's about resources. I'll paraphrase it and kind of go to, there are a lot of local governments especially have a lot of priorities. How can community members best help their local government, their state government, think about the types of investments that should be a priority?
Yeah, oftentimes we talk about this, and I don't mean to be crass, but we talk about best buys and the most important things. And I think the community, when I talk to communities in the Central Valley of California, for example, when I talk to the town council, they're very much influenced by the communities. And so I have the community talk to the town council, and the communities care about what's going to happen the next generation. I want to make sure that the world is safer, and especially for my children. And so because of that, that's helped the town reorient their priorities for example, switching to electric vehicles, making sure there's air filters in the schools, making sure that there's the ability to pass out free inhalers when people have asthma attacks or filters. So I think as the more you talk to your town council, because remember, they're citizens too, they're part of your community. And you can also put economic arguments forward why this is important. Those economic arguments are more and more becoming part of the public knowledge. And if people are interested, I'm glad that Tina put my TED Talk in the link, because that's another framework that you can show your council members that, hey, it's worth the money because you're going to get so many benefits in terms of good health outcomes, as well as just making the town a better place. Does that help you, Sadie? I hope that does.
I hope so too. I mean, you've shared so much actionable information. That's really fantastic. And I'm sorry to say that we're approaching the end of our time together. Do you have any final thoughts that you'd like to share?
Well, first of all, thank you for inviting me, and thank you for your work in the Nature Conservancy. And my final thoughts would be that I hope all of us can move forward with actions, and that the world is changing. That is true, and it's changing in its climate in many different ways. But that as we think about how to move forward with this, we need to lock elbows with each other, work as communities, and then also persist and have that tenacity to move forward, and making sure that anything that we say, it's science-based, but that we're going to be solutions oriented. And I'm really positive that we can deliver on the hope and promise of a lot of these science solutions, because they're working so far. to the extent that we're measuring them. And we need to do better always, but I'm excited about the future. I really am hopeful.
I love it. Well, thank you so much for joining us today. And thank you again to all of you who support TNC so generously. We'll be sending everyone a follow-up email over the coming days with a link to a recording of this webinar and some of the resources that were shared here today. If you're enjoying our webinars, please be sure to share them with your friends and colleagues. And you can follow us on social media at conserve_MA on Facebook and Instagram to keep up with our work and get updates on upcoming virtual opportunities to connect with us. As always, you can register for future webinars at nature.org/MA webinars. During our next webinar on June 27th, the last of this season, we'll be joined by Bob and Monica Leverett as they give us a tour through some of the notable old growth forests of the Northeast and their importance in mitigating climate change. We hope you can join us then. Thank you again and have a wonderful afternoon.